here we go. Well, welcome everyone. Thank you for joining. I am Erica Desper. I'm the founder of Confident Parenting and now the Confident Parenting Collective. Very briefly about me, I'm on a journey, or I should say, our family's on a journey with our son. He is 13 and we are just now learning what all of his diagnoses are. And I'm sort of on a mission because of our journey to get information and resources to other families earlier on and more easily than we were able to come by information and resources, which is exactly what brings us here tonight with our guest, Dr. Lana Schapiro, who is a developmental and behavioral pediatrician. I feel fairly certain that if I had known what one was way back when, or had anyone had suggested to me to reach out to one, we probably would have had a much shorter, more concise journey. Of course, it makes me a little frustrated and angry that we didn't. And so I'm really, really excited that you're here tonight to answer parent questions. I feel like if someone could benefit by seeing a practitioner like yourself, we should definitely consider it early on. I can think back to preschool red flags with my son now. So it's unfortunate that those red flags didn't get discovered till 8th grade, right? Anyway, enough about me. I'm so excited to have you here. Thanks everybody for joining. I do want to say I have a cold and a cough, so forgive me if I have a coughing fit while we're recording. I also just want to remind everybody that Dr. Schapiro, of course, can only give general answers tonight because these are sort of medical questions and every situation is so unique. So of course, you'll do the best that you can. And if you have a question while we're talking, please go ahead and put it in the chat. And without further ado, Dr. Schapiro, please tell us a little bit about yourself and then also what is a developmental behavioral pediatrician? What do you do? How does it differ from just a general pediatrician?
Absolutely. So first of all, thank you for having me. And I also just want to say that it's a journey. It's a marathon. It's not a sprint. And for all parents out there that, you can always look back and say, would have, should have, could have, but you really need to give yourself grace because it's life and, things reveal themselves over time. So give yourself grace out there, everyone.
Thank you.
Okay, so a developmental behavioral pediatrician is a pediatrician and it's a subspecialty of that. So I went to medical school, I did my residency in pediatrics, and then I did an additional fellowship in developmental and behavioral pediatrics. The way I describe it is kind of like a super pediatrician and a combination of various specialties. It doesn't mean I am the same as these specialties that I'm going to mention, but it means that my job consists of elements of each of them. So first off, my job is to look at a child's medical profile and everything that's going on in their life medically, and to see how that's affecting their development. So first of all, things like sleep that are really common, like issues that tend to come up that need to be addressed, are sleep, neurological differences like movement disorders or seizures, genetic differences, nutrition, constipation, reflux, hearing or vision impairment, and also like chronic ear infections or obstructive sleep apnea. Those are the most common things that I tend to see in my patients, but there's others. For anyone, you can't separate the mind from the body, and your body and mind interact with one another. And what affects one thing affects the other. And all these things affect a child's mood, attention, behavior, and development. It's a lot harder to learn if these things aren't as optimal as they can possibly be. So that's one thing that I do. I'm also have elements, so that's where I'm like the super pediatrician, and I manage all of the review of systems. I try to make sure each patient's seeing any specialists if they need to, and are following up with that to maximize their physical health. I also do things that are similar to a neurologist. I do full neurological exams, and I diagnose a lot of the same things they do in terms of things like that I'm going to mention is my bread and butter, like ADHD, cerebral palsy, and developmental delays. Another element that I have is I do medication management like a psychiatrist does. and I diagnose different developmental and behavioral differences. So my bread and butter are things like all sorts of developmental delays, speech and language delays, both receptive, the language that you understand, expressive, the language that you speak, gross motor delays, so your big motor skills, fine motor delays, your small motor skills, neurodivergency. So commonly people say autism, ADHD. We're starting to move into other terms like neurodivergent, intellectual disability. I already said cerebral palsy, selective mutism, anxiety, depression. Those are the things that I tend to manage, as well as ADHD, which I mentioned before. I also help families navigate if there is a genetic difference, what those learning profiles look like. So different sorts of learning differences that can be associated with that. And I help families both prepare for if those things do happen, as well as what to watch out for and how to address them if they do. I also am similar to a psychologist in that I do developmental testing, and I do school observations. I develop behavior plans for families to address targeted issues that they're having, work with the school system to advocate, develop different accommodations for the classroom. Not sure if I'm missing anything that I mentioned already.
I mean, if you are, it already sounds amazing. I remember watching Dr. House a long time ago. You sound like the doctor. Sounds like developmental behavioral pediatricians are the Dr. House of pediatrics.
It's really satisfying when you find different things that you can help with that will also affect a child's development. It's really satisfying.
Yeah,
I
that's
agree.
amazing. That's amazing. Well, wow, it's so impressive. I'm so excited that you're here, and I can't wait to hear your answers as best as you can give to all these questions that parents have. So, first one on our list, and again, if you have one you want to put in the chat, go for it. There's actually a few that kind of go together, so it may just be one question, but one parent asked, has the demand for developmental pediatricians increased exponentially in the last 5 years, making it difficult to get an appointment with one, or is the main line simply underserved in this specialty? And another parent asked, why are waitlist years long? So I have a feeling that can be rolled up into one.
Yeah. So first, there's an issue with our healthcare system. I'm just going to address that first. So for many, many years, we didn't train enough doctors. We did not have enough doctors to serve our community. Recently, within the last 10 years or so, the government opened up many more medical schools, but they did not open up as many residency spots or fellowship spots. So we also have more people graduating, but not everyone can move on with their training. So that is another area that's very difficult. And then realistically, people go into pediatrics too because they love it. You don't make as much money as you do in other subspecialties. So that's less people go into it in general. And then so like developmental pediatrics is even more so as well. So the way that the reimbursement works in our country is people get paid based on procedures or surgeries, imaging studies, and you don't have that in developmental peds. So you're going to have a much smaller portion going into this to begin with. Just being realistic, both from a governmental standpoint and an individual standpoint.
That makes a lot of sense, and I'm sure we can't totally speak to other areas, but it sounds like it's more of a nationwide problem, not just a problem in our local geographic area.
Yes, exactly.
Yeah, it's unfortunate. And then I guess this wasn't one of the questions, but we're just more aware. Some more parents are seeking.
So that's so is it more recent? So I think that compared to when I was a child, for instance, we're really tailoring our education differently than we did 40 years ago. So we're looking at each child and seeing how they best learn. And I don't think personally that the incidence necessarily has changed, although the data does show that. But our definitions of these things have also changed over time, and our awareness of different learning needs have changed over time. So that's one thing. So I think that we're more aware. There used to be this idea of, bad kids. And now that's not something we're discussing. We're saying, a child's having difficulty learning this or understanding this. So how can we help? And that's very different than it used to be. So I think that the incidence is going up because of that as well. And then COVID really affected things. So language development, especially with masks, social interaction, a lot of children are behind in many areas of their development because of that.
Yeah.
And that's going to take time to get
Well,
back
that
on
makes
track.
sense.
Mhm.
Okay, well, and then that probably maybe ties into the next
Yeah.
question. Why are so many providers, whether in your subspecialty or just in general, going in the direction of being out of network, which I know is incredibly frustrating to so many of the parents I come in contact with on a daily basis, and to myself. What if we don't understand that? Why is that happening?
So I think it goes back to the reimbursement aspect of it. There's a lot of pressure. Again, people who go into this field in general really love it. Often have a deep connection to the field, whether it's family members or themselves that have experienced these things in their own lifetime. And there's often a personal connection. Having said that, there isn't much reimbursement. And a lot of the hospitals are then being forced to have shorter evaluations, not addressing everything that we were trained to address necessarily. I'm giving general statements here, so I really don't want to speak disparagingly about anyone, but that's why. So, and then also dealing with insurance companies is very cumbersome. There's a lot of red tape, and as a solo practitioner, it's really not possible, unfortunately.
Yeah, and then I could see how that would all go together. If more providers are going out of network, then more parents are going to the larger places that do still go through all the red tape, which is increasing the wait list at the larger places.
It's like a perfect storm.
Yeah,
Yeah.
exactly. Okay, that's super helpful. Thank you.
Yeah.
Okay, and then another parent asked, and I know you can't speak specifically to this, but I don't want to ignore the question either. So some facilities have changed their age restrictions and are no longer taking kids under a certain age. Do you just want to speak to what ages you work with, or maybe why that change is happening?
I think that's just happening because of the wait list and because they're trying to figure out how to streamline it in some way or another.
Just
This is
like
a
they're maybe
national,
shortening the appointment times and things like that.
exactly. It's a national issue. Different hospitals are trying to streamline patients to go to different departments sometimes, or just trying to lessen the wait list for the younger kids, which gets into early intervention, why that's so important. And I know we're going to talk about that in a little bit,
Yes,
but
definitely. That was our question.
but yeah, I don't really know any other reason for that. Training wise, I was trained from birth to young adulthood, so like college age, let's say. I would say, so personally, I worked in the NICU follow-up clinic at CHOP. So I do have a lot of experience working with babies as well. So starting at like 3 months.
Awesome. Wonderful.
Yeah.
Okay. All right. Next question. And anyone that just joined us, if you didn't get to submit a question in advance, feel free to put it in the chat. What should we look for in terms of developmental delays, which kind of ties in with, are you able to share anything about what are age appropriate milestones? Is there a standard deviation spread? That's a huge question, I know.
Yeah, so we kind of talked about this. I think the best way to address this question is after I can send out good resources. So the American Academy of Pediatrics has good guidance for that in
For
terms
each
of each
age.
age.
Mhm.
And then they also have at the bottom when to see your doctor. So things to look out for. And so does the CDC. They also have similar things. And I can definitely send that out
That
after. I
would
think
be
it's easier than
excellent.
like running
And then
through
I can get it to
developmental
everyone
milestones.
registered along with the recording. And I think that's
Yeah.
hard for parents because there is a spread and you don't want to panic if your child's just on the maybe slower end of normal range, but then it can
Yeah.
border on, all right, now it's like, now we really should have seen something by now.
So sometimes there is a waiting period, though. There definitely is. In order to diagnose a delay, there has to be a certain amount of delay. before you get intervention, or before you even need to worry. And it's a bell curve. So some people, some children are more advanced and some are a little bit slower, and it could all be within the range of normal. But the other thing is your general pediatrician should be doing surveillance at your well visits to check in on these things, and they will catch things if they pop up. But I also really encourage families to do a gut check. So, parents usually know what's going on, and trust your gut. And if you are concerned, then I would, even make a special visit to your pediatrician as a first step, or speak to, if your child's in preschool or daycare, and talk to the teacher and say, is this normal? Is it not? I would start to reach out to people just to kind of get a better idea. And then,
and if you've heard me before, you're going to hear the
yeah.
same thing again. I just feel strongly, if we've had a lot of unsatisfactory experiences with bringing our gut instinct to a professional, whether it was a pediatrician or somebody else, and just like, no, you're just first time crazy mom, no big deal. But your gut still kind of knows something's going on. So I would say to even trust your gut for a second opinion from a second person, second provider, if it really is just, kind of going off. Because they see so much, sometimes they just tend to poo-poo it. And our guts are really, really strong and accurate. Even if you're not an expert on children, you are an expert on your child and what you're seeing. So
100%. And
okay,
there's,
we'll get
there's studies that show that, and I agree with you.
Yeah,
I'm really sorry that you experienced that. I know you're not alone.
I'm a big proponent of listening to my gut and shouting about it, but it took a long time and some not listening to it to get there. Okay, so we'll get resources on some milestones and maybe when to wait, when to worry, or when to get curious, I should say. All right, so why is early intervention so important for all the types of things that you are evaluating kiddos for?
So early intervention is important because the younger we are, the more our brain is able to learn and to create new pathways for areas that it's having difficulties. So it's called plasticity. So our brain is able to make new connections. So, and this is in any sort of difficulty that they're having, that a child's having. So you really want to get in early to get back on that developmental trajectory as much as possible. After having said that, for some of the things I see, it's not my job to change a person. I don't think that that's needed at all. But my goal for my patients is to be as successful as possible, to be independent as possible, and to have a fulfilling life and relationships, whatever that looks like. So an early intervention helps with that.
That makes a lot of sense. All right, great. And I see a parent put a question in the chat, so we'll definitely get to that. All right, so then should every parent of a neurodiverse kiddo, the parent that's asking this question, their child has a diagnosis of ADHD and ASD, have a developmental ped as part of their child's village of care providers? And they also want to know at what age and stage in the journey is that most important?
I mean, I'm biased. I think it's important. I think it's important to have someone to check in with, to make sure, it takes a village. Someone needs to be like managing everything. And my goal though is to educate my families enough that they can do that on their own eventually. But also that I'm still there to check in if needed. And I think that's really important. Because development and circumstances, behavior, mood, these things change over time. It's not a straight trajectory. And I do think it's important to have someone who's part of your team figuring all of that out and just keeping a pulse on all of these things.
I have to agree. And I don't, we're not here to talk about me, but hey, I'm hosting it. So everyone's going to hear about me. It's making me think of, we were talking before we started about my son having asthma on top of all the neurodivergence. The first thing we were dealing with was just chronic respiratory stuff. And his pediatrician felt, in her opinion, we didn't need to see a specialist because she had a lot of experience with asthma and she was equipped to help us with this. And I kind of went along with that for a while, but he just really suffered for a really long time and it wasn't getting better. And eventually I found a way to get to a specialist, and they were like, why didn't you come sooner? We could be doing something more proactive so the flares, happen less often. And I'm sure it wasn't intentional. We loved our pediatrician. I just feel like, having someone who really, really specialized in it and saw more of it more often, knew more treatments, it probably would have been better. So it kind of goes along with what you're saying. And I totally agree. All right.
Yeah.
So you think that they should be part of the village. Did we touch on at what age or stage in the journey you think it's most important?
I think that as soon, or we talked about early
Yeah,
intervention. So as soon as you're concerned, I think it's time
got
to
it.
start.
All
Yeah.
right, awesome. Our next question is, can you explain the different types of evaluations and what they are used for? I know this is really
Sure.
confusing for parents. So for
Yeah.
example, psychoeducational, neuropsychological, what does it all mean? What type do we need depending on the scenario?
Yeah. So I'll just back up for a second. When it comes to developmental differences, delays, differences in behavior, mood, mental health, it's our knowledge and our criteria for managing them are not as advanced as they are in other specialties. So there is no blood test for ADHD or autism or developmental delay. So that means that a lot of these things can get a little bit more complicated. And I just want to say there's many different ways to reach the same goal. So I'll try to break down the different evaluations. But there are times where you'll go to one and then realize you need another and be referred to different places. And that's common because there are different ways to reach the same spot. Okay. So the psychoeducational evaluation and the neuropsychological evaluation, those are the two you mentioned, differ in that, first of all, the psychoeducational evaluation takes place in the school and neuropsych is out of school. And it also depends on what they address. So the psychoeducational testing is more focused in general, and it's addressing whatever's happening in school, whereas neuropsychological testing is addressing both school and at home. So their recommendations for the neuropsych testing is going to be broader and give you recommendations for home as well, whereas educational is only going to be addressing it. If you could be doing whatever you're doing at home, but if you're not doing it in school, it's not going to be addressed. Okay. So in that way, and then the evaluations that I do are similar to the neuropsych in that way, because I'm looking at everything. So the psychoeducational tends to be more narrow and the neuropsych tends to be more broad. However, after having said that, because the brain is different from other organs, people practice differently. So I definitely see psychoeducational testing that has more or the same amount as a neuropsych testing. And the way they get to that is they often have a multidisciplinary team. So people, the speech therapist is weighing in, occupational therapist, they're looking at areas that the neuropsych testing would do as well, but you're just getting at it in a different way. And neuropsychological testing is usually what I recommend for older kids if interventions in school have not been working, they're not being addressed, and you have to go deeper.
That makes sense. Okay.
Yeah.
And as a
You
follow-up
have
to
any?
that,
Yeah. Uh-huh.
if a parent just wants to know about ADHD, for example, do they need to go the route of a full neuropsychological? Are there practitioners that can just look at that piece and that maybe brings the timeline and the cost down?
So most pediatricians feel comfortable with ADHD. So most will address that. When the medication management gets more complicated or they feel like something else is going on, then they'll either recommend that you see developmental peds or a psychiatrist, sometimes neurologist. Those are the ways it usually goes. And that's just because at a certain point, ADHD has a lot of comorbid conditions, meaning it goes along with other things like learning differences, dyslexia. So you have to kind of start exploring a little bit more at that point. And that's when they're going to recommend something else. But if it's just for ADHD, I recommend starting with your pediatrician.
Okay.
Mhm.
Great. This next question
Yeah.
is it's a perfect segue to that. When should a parent consider seeing a developmental pediatrician versus a neuropsychologist versus a psychiatrist?
Yeah. I mean, again, I'm biased. So I think I said, what a developmental pediatrician can do. A neurologist and I would go to a neurologist if a child also has tics or a seizure disorder. Then I think that they should be managing more things. After having said that, I work with a lot of neurologists. So sometimes, again, it's just part of your team and we're all in it together. Um, Neuropsych is good for one evaluation. They don't follow people over time, though, whereas a neurologist, I do, and a psychiatrist does. So developmental peds, neurology, and psychiatry does. Psychiatry, I'll just compare it to me because I think that that's the easiest way. My approach is developmental, so I'm looking at things over time. Their training isn't exactly the same way. Their approach is a little bit different. And they are also more experienced in things like psychosis, like early onset schizophrenia, eating disorders. If there's comorbidities or other conditions like that, then I recommended seeing a psychiatrist. So
Got it.
that helps. But we do a lot of the same stuff.
Yeah, it sounds like maybe we could have taken the 3 or 4 people we had, gotten a
Yeah.
one-stop shop.
Yeah, I mean, it just depends. But I do, consult with other people when needed. So I don't want to say that
Sure,
never
sure.
happens. So
It does
yeah.
take a village, like you said. Okay.
Yeah.
Our next question is a school psychiatrist's autism spectrum disorder diagnosis sufficient, or is a developmental pediatrician needed as well?
So I have follow-up questions to this. I'll try to answer it the best that I can.
It's so hard to not be able to ask follow-up questions.
Yeah. So a school diagnosis of anything is different from a medical diagnosis. Um, they allow you to have different services within the community. So you're not, even if you have, let's say, an autism diagnosis in the medical community, they won't necessarily diagnose you with that in school. If again, it's not a problem in the school setting, or it's not causing any sort of delays or any difficulty for the child in the school setting, or that they don't deem it as much of an issue for the child, or an area that they think that they need to help. Whereas a medical diagnosis will help with other things. So things like medical assistance, and you need a medical diagnosis. You can't just have an educational one. I'm not sure if I answered then the question that the people were asking, but
Got it. That makes sense. Yeah, I was also wondering, like, needed for
is it?
what?
Yeah.
I think it
Yeah.
depends if you're trying to get school supports or trying to get, secondary medical insurance. But I think, yes, without being able to ask a follow-up question, unless that parent's here and they want to chime in. All right, so let's go to thank you for all that.
They may have chimed in. Did
Oh,
you,
did
the
they?
person that
Let's
just
see.
posted, did you?
Oh, yes, sorry. We were turned away from a developmental ped because of the school diagnosis. So we're trying to get a developmental ped appointment to get extra help.
So I'm sorry. I think that goes back to them really trying to just triage and help as many people as possible. The other
Meaning
thing
they were
that,
like, you already have one.
yeah.
Mhm.
So hopefully with a school diagnosis, different pediatricians may feel like they can give a diagnosis, and after that, in general, pediatricians are trained to diagnose autism. It's not something that a lot of pediatricians do because they don't personally feel comfortable. But that may be the thinking. Again, I'm just speculating here in terms of why you were turned away. Again, just trying to get as many people help as possible. And then maybe that's what they were thinking at the time. And then the other thing for either of those diagnoses, I just want to say, I said this earlier and I'll say it again. I'm not into labels really. It's really just a way of understanding how a person's brain is working. So again, it depends on what you need it for. If it's for understanding, then either one of those would be sufficient.
Right. That makes sense. Okay. And if not, if for that parent, if you want to keep chiming in there, we'll take a peek back.
Yeah.
Another parent wants to know, this is great. I'm surprised it didn't come up earlier. How much do you find diet to be a behavioral issue?
So diet, There is less evidence for diet affecting behavior as other things, but I've definitely seen some changes in children. So there's two different ways. There's, boosting nutrition. So things like omega 3 and vitamin D have been shown to be helpful and with brain functioning. And then there's elimination diet. So the most common one would be removing dairy, gluten, and or the Feingold diet, which is removing red dye. Okay. Some children really respond well to this. I really try to work with each family that I'm seeing on how they feel about this. I'm happy to work through it with them. It's a very big commitment, and if everyone's not on board in the family, it's not going to work. So, because it has to be a true elimination. And I think that's the biggest obstacle. And then the only way to know whether or not it's the elimination that worked is by reintroducing those things again and see if the behavior returns. You also have to make sure, that the child's getting enough nutrition. So working with a nutritionist can also be helpful through this, depending on how many things you are eliminating. But the biggest obstacle that families tend to face is getting everyone on board with this.
I would think particularly if you have other children who don't need the same strict diet. Yeah.
Or one parent wants it and another parent doesn't. That's also very common. Or different homes, or the grandparents are sneaking treats to the child. Like it's complicated. But there are some, people that really do. It really just helps. So
yeah. Okay. Good to know.
yeah.
Do you, and in follow up to that, and I'm bouncing around in the chat questions.
Yeah. No,
Don't worry,
okay.
we'll get to them. Do you think the difficulty in compliance contributes to the lack of data on diet interventions?
That could definitely, yeah, I would say that definitely does. It's also hard because when you're looking at an intervention, the best way to test to see if that's what's helping is to not have any other interventions. And, usually this is in addition to something else that you're doing. So that's also difficult. Sometimes it's hard to piece apart that data as well. So you're doing several things at once.
I've had many people recommend to us to eliminate sugar or eliminate gluten, and I'm completely terrified. I know I can't be compliant. I don't have the energy to fully eliminate those things for him.
And again, with these things, as long as it's done safely, I think that it's okay for parents to try. And I'll just say though, I've seen, it work for one child and not the other in the same family.
That's
so
the hard thing, is you don't know if the effort and the compliance is really worth on it.
For some it is, and they really notice a difference like as they get older, even when they eat these things. So
yeah. Okay.
Yeah.
All right, let me go back to one up here. Does speech delay and head banging go away after treatment, or at what age do you see it disappear? And there's a second part, but I'll let you do that one first.
So this really, they're two separate things, speech delay and head banging. For speech delay, it really depends on what the cause is. And if we know the cause, the vast majority of people do with speech therapy, but not everyone does. So yeah, if you can put in follow-up questions for that, that'd be great. Speech therapy, start early, it really helps.
And that's the second part of the question. Do you see them catch up when they have a speech delay? So I'm sure you're getting to that.
Yes, usually you do. And for those that don't, there's other ways to go about that with other ways to communicate, other devices that can be used.
Okay.
But the vast majority, yes. And then head banging, that also really depends on the cause. I can list many different reasons why that would be. And it really, the banging is just a symptom of something else that's going on. So, it could be the child's frustrated because they're not able to speak. They have difficulty controlling their emotions or emotional regulation. They're difficulty expressing themselves in another way. They're in pain somewhere and not able to express that. Headaches. There's lots of different reasons that someone would head bang, or also just sensory seeking. So they like that contact and that movement. Really depends on the cause.
Yeah, in the sleep work that I do, I've had some headbangers, and it's nothing's really wrong. They're just, but it's hard. They look like they're doing it very vigorously, so you'd think, well, how is that soothing? But I know that can be one of the manifestations of that. Okay, and let's
It's
see.
really common before sleep, though, for people to do that, actually, like more common than people realize. So
Yeah, and really hard to prevent or redirect. I have tried.
mm,
All right. So yeah, some are saying red dye. Surprised that that's a real thing. I know. I feel like I heard
it
about
is.
the Feingold diet when I was like a late teenager. Maybe that's been around for a really long time. It
Mhm.
it seemed kind of fad-ish, but if it's still around,
Again, like
there might be something to it.
I know some patients who have had great success with it. So it
Yeah.
depends. Yeah.
Yeah. And then another parent said gluten wasn't as hard as they thought. Tried it for myself, slowly working on my little guy with ASD. Well, good for
Yeah.
you.
Yeah. Let us
That diet is
know how
called the
that goes.
Feingold diet, which I think is FEIN gold.
Yeah.
Yep. And I can
Yeah.
see if I can find a link and put it in the
Yeah.
chat. While we're still on the speech delay, can you go over we might have touched on this. The common causes of speech delay is another question we have.
So hearing difficulty, this is why at 18 months of a child's speech delay, they should always see an audiologist and have a full hearing evaluation. Um, and then there's various reasons for that. It could either be, chronic ear infections, chronic fluid in the ear, or it could be that a child was born with decreased hearing and that is not necessarily detected on newborn hearing screens. It could be, or also that they've taken medication or something happened since then that's caused a hearing impairment. Another one is just delay. Sometimes it runs in families that children have speech delay. I think we talked about earlier COVID. There's a lot of speech delay. A lot of kids weren't able to see people's lips move or, repeat sounds as much as they were used to with the mask wearing. And then we also see it along with other broader developmental differences. So things that end up being like intellectual disability or neurodiversity, autism, those are also common. And then there's times where children have speech delay only in certain settings, and that's something called selective mutism. So there could be different reasons. And then also something like apraxia. I could keep going. Like the differential is long.
Right.
So
And for
apraxia is
anyone
like
who's not
movements in the
familiar
mouth.
with
Mhm.
apraxia, is there a brief description of
Yeah.
what that is?
Yeah. So that's when there's just like the difficulties in the motor movements in the mouth. So the tongue, the lips, the way that they're moving their palate when they speak. And so a speech therapist will work with them on that. Strengthen those muscles and to be able to produce those sounds. I could keep going though with
I
other
know.
options, but
It
I'll stop
reminds me
now.
of when I was training for lactation. You learn what a complicated thing it is to like suck and swallow, and everything that's involved. And I know it's similar with speaking. So it isn't always something. I don't want to use the word tragic. It isn't always something complicated. It could be something as simple as like one of those things is just not yet doing what it needs to be doing in combination with the other things.
Yes.
Okay, and I did put a link to Attitude Magazine about the Feingold diet.
Okay.
Anybody needs that in the chat. Still on diet, do you suggest multivitamins and other supplements such as iron? So I know you mentioned omega-3s can be helpful for the brain.
Yeah. So there's different views of this. People say that if you have, a if your child's eating a good variety of foods and their nutrition is good, then you don't need to supplement. Other people recommend a multivitamin for everyone. I personally think a multivitamin is fine. And then for iron, iron has been shown in terms of things that I see are if your child's having difficulty sleep because of restless legs, iron is very helpful. You know, Erica. Or if they have anemia and they're very tired all the time, things like that. I would always just make sure you talk to your doctor about it, whatever you're trying with these supplements. My view of them is as long as they're safe, then give it a shot usually. But I really think it's important to run these things by your physician first, just to make sure that it's safe, because a lot of these things out there aren't. Um, iron is, vitamin D is, omega-3 is, but other things are not. So
Okay,
yeah.
awesome.
And you can have too much vitamins. There are some vitamins you can have too much of. So this is why I'm saying have a discussion with your doctor before
And of
overloading, including
course,
iron.
our
So
neurodivergent kiddos
yeah.
often struggle to sleep. So just an aside that magnesium can be helpful for that as well.
Yeah.
But we're not here to talk about sleep tonight.
No, you
We can do that another time.
can.
Yeah, sorry. I only sent the link to one person in the chat. Now I sent it to everyone in the chat. Okay, so there was one question I skipped over up here. I don't even know if you can speak to this. What are some benefits of genetic testing? You touched on it regarding learning differences. One parent is for it and the other one is not.
So I'll talk about the first part first. So benefits of genetic testing, we learn more and more over time. A lot of things, the more people that get genetic testing done, we see that there's a genetic component. Our knowledge is constantly growing in this area. So even if you don't find anything now, you may find something, 3 years from now or 5 years from now or 10 years from now. So it's really an area where we're growing in terms of research and knowledge and what does this mean? And this has to do with anything, not just the things that I see, but everything in our world. So people are looking into, if you like cilantro or not, what does your genes say about that? So this is an area really where it's growing. It's beneficial especially if there's other medical things going on, just to screen to see if there's anything that we do know of and if other body parts could be involved and need to be checked up on. So there are certain genetic differences that, people also have difficulties with their kidneys or their heart, or there's other things that may not show right away until it's really a problem. So it can be a tool in that way. Yeah. Ask follow-up questions if I didn't address something.
We recently had genetic testing done for my son to see which ADHD medication would maybe be, I know it's not an exact science,
Yeah.
but would maybe be more effective or more quickly metabolized or whatever, which I found kind of fascinating. I don't know yet whether it's true.
So that's also hard because going back to the brain, we don't know as much about it as we do with other organs in our bodies. There's something called the blood-brain barrier. We can't test the brain chemistry as easily. And so we don't necessarily know exactly how all these medications work to begin with. So then to look at the genetics is also complicated, but people are looking into it and really trying to figure it out. And that's an area that's growing as well. So I hope that it works for you. And over time, it's just going to get better and better, but we are limited in our knowledge.
Yeah, for sure. I mean, on one hand, it's great that knowledge is growing, right? We want that, but it makes answers hard and it makes it a little more complicated for parents.
Yeah.
All right, awesome. Parent says, thank you. You're welcome. Okay. Well, we wanted to try to keep this not too long, and we've gotten through the list of chat questions and questions that parents that couldn't be here submitted in advance. So one thing I wanted to ask, before we get to wrapping up, before we let you go, if you could give just one piece of advice to a family, what's the single most effective piece of advice you would give to a family in the face of significant behavioral challenges at home? Because that's probably where we all are.
Yeah. The one piece of advice is honestly that you need to put your oxygen mask on first. You need to take care of yourself as a parent. There's no other way to do it. For your child, it's to meet your child where they're at. But you're not going to be able to do that until you take care of yourself. You can have all the best advice in the world, but if you're not present and well rested and as in the moment as you can be, and your cup is not as full as can be, you're going to have less patience for your children, and that's normal and understandable. That's going to make it a lot harder. So that's my piece of advice. Help each other. Takes a village.
It really does. It's so much easier said than done. I was at the bottom of my own list for a very long time, but you can only do that for so long. So
yeah,
just like the oxygen mask. Well, this has been awesome. Thank you. So lastly, Keith, you want to ask something? Yes, go ahead. Do you want to unmute? You're welcome to.
I'm muted. I actually also submitted a question.
Oh,
Um, so thank you so much, both of you. This has been like so interesting, and this is one of the few times like being a parent in this situation. Any parent is always exhausted, but like this is one of the few times that as a parent in this type of situation that I've been able to participate in these. And thank you both so much, the two of you doing this, and I'm so happy because I've like gotten so much out of this. So my question specifically was, or not even, it's what I submitted. I've learned a lot, but so my question is, um, that to what degree has uh, the autistic population have input onto the way that you practice, how you practice? And in that, for anybody else listening, this is more so towards like being a gay man, or like, and so like recognizing that like I go to a primary care physician and they have no idea about LGBT health, and now they're just starting fellowships so that there's like specifically tailored things to our patient population. We know that women's health gets better when like women have a say in what's going on, like Black women and like birth populations, like all that is like all this interrelation, when it's not just like a heterosexual white man neuro like typical person looking at this, when you actually get a viewpoint of the patient population into how the care should be happening. How is that informed with what you're saying? And I'm especially interested to hear because I've heard you use the words of like neurodivergency and like neuroaffirming and other things. So I'm really interested to see like how you have incorporated this into how you practice.
yeah. So I just want to back up and say that there's always been neurodiversity in our society. This is not a new concept. We're just kind of looking at it differently, I think, over time. So our society wouldn't have been able to move forward without it. These are the inventors. A lot of people are inventors, are artists, are working in the tech field. There are a lot of amazing aspects to neurodiversity that have really moved society forward. I will say that, having said that, I think I mentioned this before, a lot of people that go into this field either know someone, a friend, family members, or they themselves have experienced these things. So in that way, that's moving the field forward. So a lot of people in this field do have a connection to the patient population in a personal way. And the more people, the more providers that come out and talk about that, and especially the researchers that come out about that, will continue to move care forward. So there's different TED Talks out there. There's a researcher in Australia, especially, who is neurodiverse, and she talks about the importance of doing research that really stems from the population itself and isn't kind of a top-down approach, but stemming from bottom up, I guess. I don't know really how to explain it. Does that make sense? So I think that I can only speak for myself, like how I use it to incorporate how I go about things. But my view is, again, I have a personal connection. There's I have a holistic approach. I really try to look at the family, and it's absolutely changed my practice for the better. And I think that you're going to see more and more of that as people come forward and really start to move the field forward. Does that help at all? Yeah. And I do think it's important. Also, I know personally there are some like Facebook groups or other places where you can go that to ask adults what differences, how they feel about different things. And I do that as well to get some feedback if I'm not sure. So,
yeah. It's an ongoing discussion, right? I guess as we're learning about the data, we're learning who's going to inform all of the learning, right?
Yeah.
All right, awesome. And Keith, we're so glad you were here. We get a lot of moms, so it's nice. It's nice to have everybody represented, caregivers, everybody, however anyone identifies. It's great to have everybody. I
just want to say that you address everything to parents, and thank you so much. I'm a single dad who's married to an ex-husband.
There you go.
ever anybody doesn't start something with, "Hey, moms."
I know, I try really hard.
I have the most respect for moms doing what I do. So I thank you so much for not leaving.
Yeah, you're welcome. And we also get, there's a lot of caregivers that are grandparents that have taken over, or, it's just, it's everybody now. So, right, we do. I hope that most of us are working hard to broaden our language. It's definitely, it takes there's a learning curve to it. Just if you're as old as I am, you have to like relearn everything. But yes, and the more that, people are joining us, coming from different areas, the more it'll help us, broaden that language. So that's awesome. Well, this is obviously a passion project of mine. So I'm always happy to hear that you parents are getting a lot out of it. So Dr. Schapiro, this was awesome. Thank you. So excited to have you here. I can't wait to share this with everybody. If a family wants to come find you after this, what is the best place, the best way? How do you prefer to be contacted?
So you have my information on your website, and emailing me is honestly the easiest. So it's Lana, Lana .Schapiro, Schapiro, D as in dog, B as in bird, P as in parent @gmail.com. So I can put it in the chat.
And I just put the link to the directory in the chat, because that's a long email address. All right, awesome. Well, this was wonderful. This is not the first or only of our expert lives. So if you enjoyed it, just keep an eye on our social media, or you can join our newsletter. We'll be doing many more on other topics, and I'm sure we'll have Dr. Schapiro back as well. But I think I have kept everybody long enough. So thank you for your questions, for your participation. And everybody have a good rest of your night, and we'll be back soon with another topic. And thank you, Dr. Schapiro, for your time.
Thanks for having me.
All right. Thank you. Good night, everybody.
Thank you.